Hi, this is Julia, and my presentation is on Zika virus. So, a little history about the Zika virus. In 1947, when they were investigating yellow fever, they found actually Zika virus in Uganda in samples taken from monkeys. The following year, that's when they identified the Aedes genus mosquito, and they found that it was carrying the virus, and this was found in the Zika forest, which is how we got the Zika virus name. The first case of Zika virus was again detected in Uganda in 1952. Now, from the years 1969 to 1983, Zika expanded. It went to India, Indonesia, Malaysia, and Pakistan, um, with Africa having sporadic cases throughout the country. And then when it came to 2007, it spread from Africa to Asia, with the first large outbreak in the Pacific island of Yap in Micronesia. Um, and then after that, from 2013 to 2014, the virus caused outbreaks in the Pacific Islands, and this included French Indonesia, Eastern Islands, Cook Islands, and New Caledonia. By March 2015, Zika actually reached Brazil, and in 2016, Zika showed signs. They were actually finding signs of Zika having neurological defects in children, specifically the microcephaly, and we'll go over it in detail in the following slides. Um, and at that same year, that's when it actually turned into a public health concern, international concern. So Zika virus is transmitted actually through mosquito bites. It's also transmitted from a mom to her child, so from pregnant women to fetus. And that's where they're able to find the microcephaly and other brain um, defects. And this happens because when the pregnant mom is bitten by the mosquito, the the infection can cross the placenta, and then from there the fetus is infected. Um, Another way it's transmitted is through sexually, so through coitus, um, which is why it's important as a prevention to um, use condoms when having sexual intercourse. Um, Something that's not very common here, but it has happened, and they Zika has been transferred through blood transfusion or through laboratory exposure. So another very important reason why we should follow protocol in the labs is to prevent these kinds of exposures to ourselves and to those around us. Um, so the symptoms for Zika virus aren't always common. Um, they're generally very mild, and very rarely do patients or people that are infected with Zika virus will need to go um, to a hospital. Um, Here's an example of a section from a pamphlet from John Hopkins that kind of gives an idea of what symptoms patients might have: rash, headache, fever, uh, kind of itchy red eyes, um, muscle pain, Malaysia, like their body pain. They can have fever. Um, so another thing that actually they've noticed with moms, also they have um, higher chance of having stillbirths and other birth defects. So and not so much a symptom, but that's something that um, people notice of children that have been exposed. Um, so diagnosis, uh, the best thing to do is to go to a healthcare provider. And one thing you do have to let them know is if you've traveled and where you have traveled and any contact you've had with people. And then from there, they're going to do a blood test and a urine test. And then they're going to see if there's like a molecular presence of the virus. And when they do that molecular test, and there's also a serological test, which looks for antibodies. Um, so that's the best way. The FDA are finding different ways to identify Zika virus, especially to try and get women in the first trimester, which is what I'm going to be speaking shortly about the patients that are at risk. So as you can see, women in the first trimester that have been exposed to Zika virus have higher risks of having birth defects. Um, it decreases by the second and third trimester. Um, again, people the people that have unprotected sex are also at risk, as well as people traveling to areas that have Zika virus. Um, Going back to the moms, they've noticed that women that have symptoms and women that don't have symptoms have the same probability of having these birth defects. So whether they are symptomatic or asymptomatic does not have a difference of how the children, when they're pregnant, the fetuses are going to be affected. Um, Another person at risk are the babies that the fetuses before they're born. They've noticed that once they are born, they develop certain defects like smaller heads. There's brain damage, and also they've noticed like vision or eye damage. Um, Once the doctors identify a mom that had Zika virus and had her child, they do have to continue to monitor and see if there's any like seizures, if the child is having any problems swallowing or moving, and if there are any developmental delays. So, unfortunately, there isn't any treatment for Zika virus. Um, Zika virus does not have an antiviral vaccine or anything of that sort. I know right now they're doing some studies on it, trying to find different cures or vaccinations. Also, the only thing that people can actually treat is the symptoms. So, the best way would be to drink lots, kind of like a cold or a flu, is just drink lots of liquids, take acetaminophen, which is like an Advil, or Tylenol, which helps relieve these symptoms. Um, Another thing that you can do is just get a lot of rest. Like I said, there is no treatment. So prevention would be to use certain insect repellents. Also have screen doors and air conditioning. Um, that helps keep the mosquitoes away. So anything that you do to prevent them being bitten by these mosquitoes that carry the Zika virus, they recommend you wear long sleeve shirts and long pants. Women that are pregnant shouldn't travel to affected areas, and people that do travel, that's where they should carry these preventative measures. Um, Also, another way is to have protective sex. So, like I said previously, wear condoms and that sort of thing. So these are my references. Most of my information came from the Center for Disease Control and Prevention. Um, I had some from Johns Hopkins and the World Health Organization, as well as the FDA.